Welcome to the second video of the day. In first video we have seen 20 questions with rational. Now we will continue with the question number 21. Question number 21. Which of the following types of burns injury is most frequent? Option A, thermal burns, B, chemical burns, C, electrical burns, D, radiation related burns. So the most common type of burn is thermal burns. Option A is right. Thermal burns, it happens usually in the house, which makes a person more prone to liquids, which is very hot, or if flames or other burns occurs. Other burns like chemical burns, electrical burns, radiation burns occurs in the working area only. So the most common type of burn is thermal burns. Question number 22. Which of the following type of leg ulcer which is often painless? Option A, venous ulcer, B, arterial leg ulcer, C, diabetic leg ulcer, D, both A and B. So the most frequent type of leg ulcer which is painless is option C, diabetic leg ulcer, because it is associated with loss of protective sensation, that is neuropathy, and the presence of ischemia with the patients having diabetes mellitus makes the pain senseless. Question number 23. There are various types of assessment used by a nurse which depends on the situation. Which of the following is performed during any physiological crisis of the patient? Option A, time-lapse reassessment. Option B, initial assessment. Option C, problem focus assessment. Option D, emergency assessment. At the time of physiologic or psychological crisis, the nurse should do the emergency assessment. That will be most appropriate for this situation. Time lapse reassessment takes more time. Initial assessment is done very shortly, and problem focus assessment needs a detailed assessment of the situation. So emergency time or in crisis situation, emergency assessment is very appropriate. Question number 24. Obtaining data is a very crucial part in planning patient's care. Which of the following type of data is also referred to the overt data? Option A, subjective data, B, constant data, C, objective data, D, inherent data. So the type of data which is referred to as overt data is O, objective data. Objective data are the one which can be detected by someone else and can be measured by using accepted standard procedure. So no other person can go and collect the data, only the nurse has to go by herself or himself to collect the data. That is more valid and reliable. That kind of data is called overt data too. Question number 25. Aside from Maslow, Kalish also presented a hierarchy of needs. Which of the following needs he incorporated or added to the 5 levels of needs by Maslow? Option A, affection needs, B, stimulation needs, C, independence need, D, recognition needs. So we all know very well about Maslow hierarchy of needs. There is another hierarchy of need theory that is given by Kalish. In this theory, which need he incorporated to the mentioned 5 needs by Maslow? So the right answer here, option B, stimulation needs. Stimulation needs is one of the needs that Kalish added between the physiologic and safety and security needs of Maslow. So from the bottom of the pyramid, we have the physiologic and safety need. Next we are having the security needs. So in between that, the stimulation needs was added in the Kalish hierarchy of needs theory. Question number 26. Which of the following describes a secondary level of prevention? A. Family planning services. B. Referring a client to a support group. C. Hepatitis B immunization. D. Deliver developmental screening test. So the right answer in secondary level of prevention, we use option D, deliver developmental screening test. So it is a test. It is an example of screening and survey and of any procedure. Option A and C, family planning services and hepatitis B immunization, are wrong because they are both primary level of prevention. Option B, referring a client to a support group, it is example of tertiary level of prevention. So option D is the secondary level of prevention, that is deliver developmental screening test. Question number 27. The definition of health is very complex and may consider a lot of factors. Which of the following models of health and wellness describes that a person is considered healthy as long as they can perform their roles in the society? So there are variety of models explaining the stage of health, that is the status of health, concept of health. So here we have four different models: A. Adaptive model, B. Role consistency model, C. Role status model, D. Role performance model. So which model of health and wellness describes a person is considered healthy as long as they can perform their roles in the society? So the right answer is option D, role performance model. Because this model considers the sickness as the ability to fulfill one's role. Option A, adaptive model, is wrong because this model deals about how an individual adapts with the environment towards great with good health. Option B, role consistency model, and option C, role status model, are also wrong because they are not included in the accepted models of health and wellness. So option D is right. Question number 28. Freud identified 5 stages of development. Which of the following correctly happens during the anal stage? Option A, 6 years to puberty. B, 1.5 years to 3-year-old. Option C, 1 to 3-year-old. D, 4 to 6-year-old. So the Freud stages of development you should remember here. The right answer is option B. Represents the anal stage. It happens in the Freud analytic psychology theory. A is wrong because it happens during latency stage. And C also wrong because it is just a diversion given in this question. No other theory is giving 1 to 3-year-old range. D, option D, 4 to 6 year, occurs in the phallic stage. So option B is correct. Question number 29. Erickson identified 8 stages of development. He pointed out that during the early childhood, the central task should be autonomy versus shame and doubt. Which of the following is an indicator of negative resolution of this stage? Option A, compulsive self-restraint. B, mistrust. C, estrangement. D, lack of self-confidence. So in the stage of autonomy versus shame and doubt, if you are not able to achieve autonomy, what consequence you will get? That is the question. So the right answer is option A, that is compulsive self-restraint. Because it is the right negative resolution during early childhood. Other negative consequences which occur in this stage include compliance and defiance. Option B and C, that is mistrust and estrangement, are happening during the infancy stage. That lack of self-confidence will occur in the phallic stage, not related to Erickson's theory. So option A is right. Question number 30. Reflexes are normal to newborn. They are unconscious and involuntary responses. Which of the following infant reflexes is also known as fencing reflex? Option A, Babinski reflex. B, stepping reflex. C, tonic neck reflex. Option D, palmar reflex. Fencing reflex. The right answer is option C, tonic neck reflex is other term for fencing reflex. You know that stepping reflex is also known as walking or dancing reflex, which disappears about 2 months. Let's see the question number 31. Which of the following psychosocial development stages is considered as the crucial crisis according to Erickson? Option A, autonomy versus shame and doubt. B, initiative versus guilt. C, identity versus role confusion. D, trust versus mistrust. The right answer, let's check. It is option D, trust versus mistrust. Because according to Erickson, the resolution of this stage will determine how a person will handle or resolve in the next stages to come. So trust versus mistrust gets the priority. Question number 32. Which of the following interventions that a nurse should not perform in patients suffering from hypothermia? Option A, cover the client's scalp with a cap. B, apply warm blankets. C, provide a warm environment. D, keep limbs far from the environment. Sorry, from the body. So, which of the thing the nurse should not tell the patient to perform during the time of hypothermia? The right answer is option D. Keeping the limbs from the body is not advised during hypothermia. Question number 33. Which diagnostic procedure will confirm that the client is having dengue hemorrhagic fever? Option A, blood smear. B, urine and stool examination. C, cerebrospinal fluid examination. D, sputum examination. The right answer is option A. Blood smear is the diagnostic test to confirm dengue hemorrhagic fever. Question number 34. In a child reported to having diarrhea, assessment is an essential guide for knowing if the child is experiencing dehydration. What body part should you assess? Option A, buttocks. B, abdomen. C, eyelids. D, arms. The right answer is eyelids has to be assessed for sunken eyes. That is the body part. In among this four you need to check. Apart from that, you will see the signs and symptoms of dehydration from the skin for skin turgor and various other things you will do. According to these options, you will select option C, eyelids. Question number 35. It refers to the description of a disease occurrence which is constantly present in a given area. Option A is epidemic, B sporadic, C pandemic, D endemic. So a disease which is constantly present in a given area is described as option D, endemic. Question number 36. Mohan came to the primary health center because he was bitten by his dog. What nursing consideration is your priority? Option A, administration of anti-rabies vaccine. B, provision of dim, quiet and non-stimulating room for the client. C, assessment of wound for classification, severity and other signs and symptoms. D, provision of isolation practice. So in this case, the priority intervention should be assessment of wound for classification of severity and other signs and symptoms. We can give anti-rabies vaccine, but before assessment, without assessment, we cannot determine whether the vaccine is needed or not. So we must assess and find the severity of the wound, and we must classify the wound is which type, then only we will go for administering anti-rabies vaccine. Question number 37. You are about to provide health teachings about pulmonary tuberculosis in your area of assignment. What diagnostic procedure is usually done early in the morning to confirm pulmonary tuberculosis? Option A, chest X-ray. B, sputum examination. C, bronchoscopy. D, all of the above. So early morning examination to diagnose pulmonary tuberculosis will be sputum examination. Question number 38. The client's ECG tracing shows ventricular tachycardia secondary to low magnesium level. Which of the following electrocardiograph tracing results in consistent with this finding? Option A, appearance of a U wave. B, shortened ST segment and widened T wave. Option C, tall peak T waves. Option D, tall waves and depressed ST segments. So in case of low magnesium level, the ECG findings will show option D, tall T waves and depressed ST segments. Question number 39. The nurse is providing home instructions to a client with increased adenocorticotrophic hormone. The nurse is aware that the client with excessive corticosteroids is suffering from what condition? Option A, Cushing syndrome. B, Addison's disease. C, hypothyroidism. D, SIADH. The right answer is option A, Cushing syndrome. It is clinically defined as the presence of excessive corticosteroids. Addison's disease is clinically defined as adenocortical insufficiency. Hypothyroidism is a condition where there is insufficient thyroid hormone, while SIADH is characterized by excessive release of antidiuretic hormone. Question number 40. The pineal body is an endocrine gland that influences the activities of the following except option A, parathyroid gland. B, islets of Langerhans. C, cerebellum. D, pituitary. The right answer option C, cerebellum. Cerebellum is the one which is not influenced by pineal gland. Question number 41. Which of the following lobes of the cerebrum controls the moral reasoning of person? Option A, temporal. B, occipital. C, parietal. D, frontal. The right answer is option D, frontal lobe controls moral reasoning. Others include organization of thought, body movement, and memories. Temporal lobe is wrong because it is a center for senses of smell and hearing. Occipital lobe is also wrong because it assists in coordinating language. Parietal lobe is also wrong because it interprets sensation of taste and touch. So select option D, frontal lobe. Question number 42. Dopamine is a neurotransmitter that is located in the brainstem. Which of the following amino acid is synthesized from? Option A, tyrosine. B, tryptophan. C, phenylalanine. D, choline. The right answer option A, tyrosine. Dopamine is synthesized from tyrosine. Tryptophan is wrong because tryptophan produces from niacin and serotonin. Phenylalanine is also wrong because it is converted into tyrosine by the body. Choline is too wrong because it is the precursor for acetylcholine. Question number 43. Brain imaging techniques are used to detect any mental disorders. Which of the following techniques has the fastest duration of obtaining the result? Option A, MRI scan. B, PET. C, CT scan. D, SPECT, single photon emission computed tomography. So which clinical investigation is having fastest duration of obtaining the result? The right answer is CT scan. Option C is right. CT scan is correct because the duration is only 20 to 40 minutes to get the result. MRI scan is also wrong because MRI scan takes around 45 minutes. The second fastest is MRI scan. PET is wrong because it takes 2 to 3 hours to obtain the result. Single photon emission computed tomography is also wrong because it takes 1 to 2 hours. So option C is right. Question number 44. Extrapyramidal symptoms are serious neurological symptoms which indicate the major side effects of antipsychotic drugs. Which of the following drugs used in the treatment of extrapyramidal symptom that is not characterized as anticholinergic drug? Option A, benztropine, B, amantadine, C, trihexyphenidyl, option D, procyclidine. The right answer here, the drug which is not categorized as anticholinergic drug is amantadine because it is the dopaminergic antagonist. Question number 45. Clozapine compared to other antipsychotic drugs produces fewer side effects. Which of the following is considered as the fatal side effect of clozapine? Option A, agranulocytosis, B, thrombocytopenia, C, pancytopenia, D, leukocytosis. The fatal side effect because of clozapine is option A, agranulocytosis. It is very dangerous side effect of clozapine. Question number 46. Nurse Kumar has been assigned to classify the antipsychotic drug. Which of the following should be isolated if his patient is at risk of cardiac arrest? Option A, nefadazole, B, thioridazine, C, methylphenidate, D, clozapine. The right answer, the drug to be isolated is thioridazine because thioridazine along with droperidol and mesoridazine can lengthen the QT interval leading to potentially life-threatening cardiac dysarrhythmias or cardiac arrest. Nefadazone is producing liver damage most commonly. Clozapine is associated with agranulocytosis. Question number 47. Proxemics is the study of distance zone between people during conversation. Which of the following zones should be the distance that is acceptable for communication in social work or business settings? Option A, 12 to 25 feet, B, 18 to 36 inches, option C, 4 to 12 feet, option D, 0 to 18 inches. So the distance which is acceptable for communication in the social work and business setting is option C, 4 to 12 feet. 12 to 25 feet indicates public zone and 18 to 36 inches indicates personal zone, and option D, 0 to 18 inches indicates the zone, intimacy zone. It is a very close zone, 0 to 18 inches. Question number 48. Touching a client can be comforting and supportive, especially if it is being permitted. Which of the following type of touch is used in greeting such as handshake? Option A, love intimacy touch. Option B, friendship warm touch. Option C, functional professional touch. Option D, social polite touch. Let's see the right answer. Option D, social polite touch. is right. Let's see the other explanations. So option D, social polite touch is correct. It's also include air kisses, that is flying kisses that women used to greet acquaintance when a gentle hand guides someone in a direction. Option A is also wrong. It involves tight hugs and kisses between lovers. Option B, friendship warm touch is wrong because it involves a hugging greeting. Option C, functional professional touch is also wrong because it is used in examinations or procedures such as when nurses touch the client to assess the skin turgor. So option D, social polite touch is used in business and social environment settings. Question number 49. Problem solving is used during crisis intervention. It helps the patient to find ways in order to solve a certain situation. Which of the following is not included in finding solution? Option A, if dissatisfied the result, discontinue the process. Option B, identify the problems. Option C, brainstorm all possible solutions. Option D, evaluate the situations. So here the right answer will be option A. If dissatisfied with the result, discontinue the process. So when we are not, what we can say, when we are not able to find the solution for any problem, when we are dissatisfied with the result of the problem solving method, we should discontinue the process. Question number 50. When a nurse assesses his patient, he noticed an overall slowed movement. He is correct if he identified it with which of the following terms? Option A, maxi flexibility. Option B, automatisms. C, psychomotor retardations. Option D, neologisms. So which one is right? When the patient have slowed movement, the right answer is option C, psychomotor retardness. Because option B is also that automatism is wrong because it is defined as maintenance of posture or position. Option D, that is neologism, is wrong because it is the inventing of words that only the client can understand. So right term is psychomotor retardness is right. So the 50 questions we have concluded. Now the most waiting subscriber challenge questions. Hope the question will be easy for you to answer it. Let's go to the question. While making rounds, Mary noticed one of her clients saying the following line: I have money, want to study, daddy wants honey, 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 honey bee. This is an example of option A, neologism, B, word salad, C, flight of ideas, D, clang association. So write your answer in the comment box below. We will reply to your answer. This is the way to motivate a subscriber to learn new questions without any assistance of a guide, just by referring. So this is the end of the second video of today. Hope you enjoyed all these 50 questions in both videos. Thank you. Bye bye. Please subscribe to our channel if you have not yet subscribed so far. Bye bye. Good night.